Mental illness. Mental illness, it's a clinically significant condition classified by the alteration of thinking, emotions, behavior associated with some personal distress or impairment. Mental means it's a mind. Illness is a deviation from the health. What is health? Health is a complete state of physical, mental, and social well being, not merely the absence of disease or infirmity. The human being is consists of body, mind, and the spirit. This person, body, mind, and spirit is a human. It is constantly interacting with the environment. So he has to go with the various stressors. He has to overcome the stressor. At any cost, his behavior is not going to affect, or his function is not going to affect. What is the function? Normal functions not going to affect. It is not mental. How he overcome that? He used that defense mechanism to overcome the stressors. So we are all normal. Sometimes we may feel depression, but we could overcome by using the defense mechanism. When the people couldn't do that, or stick on to one defense mechanism, excessive use of defense mechanism also will become as a personality disorder. Okay, what is this mental illness? Mental illness main causes. What is the main causes of mental illness? Mental illness mainly caused by the genetical causes, congenital anomalies, or the developmental causes, or exposure to the X-rays, UV rays, and gamma rays, and the nuclear bombing, or anything, or the during the induction, or the time of period of the delivery, or the brain injury. All these things are secondary to the some pathological disease condition also may be affecting some mental disorders. So developmental, what is developmental? Why? What is development? Because you should know that when during the conception, once the day the mother has conceived, by the time she knows that she is pregnant, her neural tube is developed, her babies. So by that time she may not be aware of that. Without knowing her knowledge, she exposed to some of the radiations and x-rays, or she has taken some kind of a tablets or something. The neural tube defects will be coming, or the brain development will be getting affected. So why it is? Because within 4 weeks only the brain is completely developed, within 4 weeks. Then what's happening? By the time mother knows, maybe 5th week only confirm her pregnancy. So to prevent that only, we are giving folic acid tablet to prevent the neural tube defect or the malformation, and we avoid the consanguineous marriages, blood related marriages, also more prone to get the mental illness. And also hereditary means the hereditary is the genes. The some of the disorders, especially schizophrenia like a disorders, are transmitted from the one generation to the another generation. So that's what the mental illness is, a clinical significant condition which is classified by alteration in thinking. Normal person, how is thinking? They will think illogical thinking, or extraordinary thinking, overthinking, emotions. What is called emotions? Crying, or often you cry, you are the mental disorder, or the behavior associated problem, and this all will lead to the impaired function. So this will lead to the impaired function, means bodily function. They may not go take bath and do the routine work. Their day-to-day life also been affected. These psychiatric illnesses are broadly classified into psychosis and neurosis. Psychosis, they not aware of that they have the diseases. That mainly we are dividing into schizophrenia and the mania and bipolar and depression, like a mood disorders, right? And neurosis is OCD, phobia, anxiety, post-traumatic stress disorders. So they are aware of it, but still we need lot of therapies to cure them. That. So this is the mainly psychiatric illness are classified. Only this one? No. The other than this, we have many classifications like eating disorder, anxiety disorders, and sexual disorder. Many things we will see, but the major classification is psychosis and neurosis. Under the psychosis, schizophrenia, mania, depression, and bipolar diseases. Neurosis is OCD, phobia, anxiety, post-traumatic stress disorder. If you see the broad classification, neurodevelopmental disorder. What is ADHD? That is the attention deficit hyperactive disorder, autism spectrum disorder, cerebral palsy. That all the muscles will be very rigid, birth itself will be there, birth defect itself will be the learning disabilities will be there, intellectual disabilities or the like mild, moderate or severe mental retardation. Some child will be looking normal, but when the mathematics will be difficult to understand the mathematics, so slowly only they will identify the autism disorder also. Initially the parents or the doctors cannot, so they will be concentrate focused on this. When you are calling the name, they will not turn and look at you. They will be in their own world. They catch their own toy and stare at them like that, this one. So communication disorder, their language and other things, communication, they will not do the communication. And then psychiatric disorder affect the mind is a preconscious, unconscious, preconscious, semi-conscious mind. That's a psychology we have studied. So we are well, a good person knows well oriented about the time and where we are, what time, where everyone we are conscious about it. But this some kind of a disease is coming under when this is being deviated from this one. It affects the mind. You will develop some delirium, and then will be the hallucination will be there, depression they will be going. The first one in the psychotic disorder, schizophrenia, paraphrenia. Mainly will be how you have to treat catatonia will be very rigid. They will be keeping it like this. They will be very rigid. So how you will be treating them? Haloperidol, and then chlorpromazine, and benzodiazepam, and then diazepam tablet will be given. ECT also can be given to them. And this schizophrenia is the diseases also may come from the one generation to the another generation. So the mother is affected slowly. Very various factors they may get in their family. So we have to watch into that. We can prevent, divert them, and engage them with this. We can do that. So they also have various signs and symptoms. Delusion will be having, sometimes hallucination will be there, and especially they will have a depression also. The other disorders we are seeing this anxiety, fear and anxiety related disorders also. What is fear and anxiety? Fear and anxiety simply they will generalized anxiety. Everything they will be fear. Agoraphobia, the height place you are going, there will be, and panic disorder, how they will be feeling, and then some specific phobias. Especially in seeing something suddenly, otherwise they are normal, seeing or empty space they will be very much fearful. Always stress and anxiety, when they see that this one main signs and symptoms, they are very much restless, and palpitation will be increased, shortness of the breath will become, dry mouth, nausea and insomnia, they will be thinking about that only. So these are all the main symptoms. Mainly you have to give them more counseling, you understand their condition, family therapy, education you can give immediately. These like persons, you cannot start with a tablet, you can go for CBT, and then you can give them counseling and other therapy, psychotherapy, family therapy, interpersonal psychotherapy will be much more helpful for personally you can go with them, and diversional therapy also will be very much useful to reduce the fear and anxiety. If not, you can treat with beta blockers, benzodiazepines, and the antidepressant tablets, and then these tablets also will be helpful to treat them. And if you see the mood disorders, the mind, if you take the mind, conscious mind, unconscious, the mood emotions, like, right, emotions also will be affected. Why this all coming? Main cause may be why the mood disorders are coming mainly. Sometimes people have some trauma, suddenly earthquake has come in Wayanad, or some mind is been affected, loss of loved ones, and then some of the thyroid disorder, or the vitamin D or any other vitamin deficiency also may cause the mood disorder. Bipolar disorder, bipolar, low mood and the high mood. The low mood means they will go for the depression, high mood will be the manic disorder. And then cyclothymia, cyclothymia means the chronic unstable mind, suddenly they will be good and suddenly they will go for hypomania, And then major depressive disorder, persistent depressive disorder, on and off they will be go for depression. And premenstrual dysphoric disorders, premenstrual symptoms, they will be mood will be immediately will be affected. And postpartum depression, after delivery they will get it. And depression with the psychosis, with the psychosis means they will have the hallucination and other things. So the mood disorders are mainly treated with antidepressants and mood stabilizers. Mood stabilizers, lithium they are giving, and antipsychotic drugs they are giving, along with the group therapy and behavior therapy. As usual, you can give them. And then also these tablets has to be give whether they are taking it. As a psychiatric nurse, we have to see that whether the patient is taking rightly in front of you. That is a very, very important. Then OCD. OCD is nothing but it's obsessive compulsive disorder. It's also the stress related disorder. The main thing is a mental trauma and something to overcome the fear. They will be doing that. So post-traumatic stress disorder, or they cannot adjust with her spouse or something, they'll go further. And dissociative disorder, it's like a defense mechanism. Excessive and dissociative identity disorder, they will act like they are like a multiple personality. They will act like they do not know who they are. And dissociative, they will be like they themselves, they do not know who they are. They will think that they are the other persons. Some person is told, one girl told, I am a Kalpana Chawla, I know everything, I know. She act like a different personality. Kalpana Chawla already died, but they think that she is the Kalpana Chawla or Indira Gandhi. Many patients I have seen like that. And then dissociative amnesia, and then depolarization, and the derealization disorder, feeling from detached from oneself. Depersonalization, so that not polarization, sorry, depersonalization and derealization. So they cannot realize who they are. They will be detached from the feeling of I am who I am. They do not know. They will be detached feeling. They will be in the another world. So then will be the eating disorder. So eating, what is going to be the disorder? Yes, sometimes people, especially anorexia, the girls are very much health conscious and they will fear of getting overweight. So for that they started to avoid. Their health condition will become very low. Her BMI will be go less than normal. Because of that, they develop various health problems and issues. Then this is anorexia. Bulimia, just opposite to the anorexia. If they are very stressed or something, they will be overeating. Too much will be eating. Binge eating, there will be a time will be reduced. So often they will be eating. Bulimia always will be eating excessive weight. Binge eating also, the time is also reduced. They are also will be avoided. They will avoid the food. Then the elimination disorder. This first one is enuresis. Enuresis is nothing but bedwetting. Then encopresis is called the fecal incontinence. Suddenly, often there will be one boy, 5th standard he is studying. Mother is telling, I am very much afraid to send my boy to the school. Often if he is tension, he is passing the stool. So because of the anxiety and stress maybe, and the disorder of bodily distress. There is a somatic symptom disorder. Like something is going on, I feel something, psychosomatic somatic disorders, like cockroach is always in my hand, dissociative neurological symptom disorder. And then chronic fatigue syndrome, they are very tired always. And this one. And another important thing is called the addictive disorder. Addictive means sometimes children are very much addictive. Even we ourselves will be addictive sometimes. Every time, sometimes we are using the Vicks, means it become habitual. When before going to bed, you take, even you do not have a headache, you will put some Vicks in your head. And sometimes what will happen, the smell of kerosene, smell of petrol, or substance abuse, sometimes that is also addictive disorder. Why? Not only alcohol and caffeine or something else, they are addictive to the, but sometimes these smells, all called the addictive, they cannot resist, they cannot control. Then non-substance abuse like viewing of bonogram and using of phone always, and then internet addiction and sex movies or having a sex. If you take the phone or some of the substances which you are addicted, they will develop the withdrawal syndrome. How the alcohol people, we stop that, they will develop the withdrawal symptom. If you give only, they will become normal. So that is the that is a kind of a disorder. And then impulsive control disorder. Impulsive means they cannot control, they cannot resist themselves, they are very much aware of this. Stealing is not good, but kleptomania, they want to steal they want to steal, they simply they go and steal, not for the purpose, just they have the disease, the impulsion to steal, take like that. Then the oppositional deficient disorder, hostile behavior. You tell them to not to do, they will break the rules. You put one rules, they will oppositely. The contact, character and contact certificate, we will tell no. Character and contact will be, if you violate the rules and regulation, you will get a character and contact will be baby, behavior will be. But these people, always you put a rule, they will break the rules. So that is a disorder. They are very happy. When you tell something, they will do opposite. Then intermittent explosive disorder. That's a frequent impulsive anger outbreak. Suddenly they will get some anger. Pyromania. Then disruptive behavior disorder. It's a group of mental conditions with the symptoms. Disruptive behavior. This person means he will behave like that. You cannot predict them. Suddenly, sometimes he will behave abnormally. Sometimes he will violate the rules, violate the rights. What are all the symptoms of this one? If you remove the bone, you phone from this person, you will see how he is violating. He is very aggressive, arguing and bullying, stealing. So he will behave with disrespect with you like that. These all you can see the signs and symptoms if you remove this one. So main thing, you have to give them group therapy. Cognitive behavioral therapy will be always helpful. Then you have to give him medication and the rehabilitation. What is rehabilitation? Rehabilitation is nothing but the medical, social, psychological measure. Train and retrain the person to maximum potential to lead his normal life. So you are helping him in all the way. What are the way? Medication way, medical way, social way, and rehabilitative way. All the therapies way, you will help him to lead a normal life is called the rehabilitation. So the rehabilitation must be in the current trends in rehabilitation. The initial stage itself, you have to start the rehabilitation. Either he is a psychosis or neurosis or mania or depression or anxiety disorder or anything. One is called the personality disorder. So what is personality disorder? We'll see in the next video.